KPOA 93.5, 7:20 in the morning. And as we do every Thursday, on the phone line, one of our Ohana members from Maui Health. We want to say good morning to Devin Doss, CPHQ Performance Improvement Coordinator at Maui Health. Good morning, Devin.
Good morning, Shane. Thanks for having me.
Awesome. Thanks for calling us this morning. Devin, it's Sepsis Awareness Month this month. We talked about this last time, but remind us what makes sepsis so dangerous and deadly.
So, Shane, thanks for asking. Sepsis is a serious condition that happens when your body has an extreme dysregulated response to an infection. So basically, if it's not treated promptly, it can cause organs to stop working properly and can ultimately be life-threatening. So with sepsis, early treatment is very important.
Yeah, for sure.
With September being Sepsis Awareness Month, it's crucial that we use this time to educate people about the dangers of sepsis. Just as September marks the end of summer, sepsis can mark the end of proper organ dysfunction if not treated properly.
You know, Devin, are symptoms easy to spot?
So, good question. As we fall into September, it's important to remember that anyone can fall victim to sepsis. And the symptoms can sometimes be subtle as the changing leaves, so it's crucial to stay vigilant. Symptoms can include fever, chills, shortness of breath, rapid heartbeat, confusion, extreme discomfort, or pain. But when it comes to sepsis, I try to ask people to remember the acronym TIME. It's all about time. Temperature, infection, mental decline, and extremely ill.
Okay.
So if you experience a combination of these symptoms, we recommend you seek urgent medical care and ask, could this be sepsis?
Nice. That's a great way to determine. Are there any specific groups who are at higher risk for sepsis?
Yeah, anyone can develop sepsis, but there's certain groups that are definitely at a higher risk. These include like older adults or young children, but definitely people with weakened immune systems or those with chronic medical conditions like diabetes or lung disease or cancer or kidney disease. They're definitely going to be at higher risk. So it's particularly important for those groups and their caregivers to be aware of the signs of sepsis in order to seek medical attention promptly if they suspect it.
Yeah, I agree. As we wrap up, what's one key message you want our listeners to remember about sepsis awareness and prevention, Devin?
Well, just as September marks a change in seasons, we want this month to mark a change in sepsis awareness. Remember, sepsis is a medical emergency, and if you suspect sepsis, don't let the symptoms fall through the cracks. Seek medical attention immediately. And prevention is key. So good hygiene, keeping wounds clean, staying up to date with vaccinations, and managing your chronic conditions well, they will all these steps will significantly reduce your risk of developing infections that could lead to sepsis.
Exactly.
So this September, let's all pledge to be more aware and proactive about sepsis. Together, we can make a difference in fighting this life-threatening condition.
And with you bringing us the information this morning, we are more aware and one step ahead of the game. Thank you, Devin, for calling us this morning.
Thank you for having me, Shane.
Talk to you again.